Good morning, everyone. Welcome to the CU School of Medicine Town Hall. Last time I was joined by two newly appointed executive leaders, Dr. Vineet Chopra, Interim Executive Vice Dean overseeing research and clinical affairs, and Dr. Shanta Zimmer, Executive Vice Dean of Education. You may remember we had a robust conversation about reaching top 10 in 10, my personal goal for this campus, and also highlighting everyone's role in that. Our enviable position in the current landscape relative to other academic medical centers, and the focus we have on all of our missions: community, research, clinical care, and education. If you missed that or wish to revisit anything we discussed, you can find the recording on the Dean's Office website. Today, I'm thrilled to be hosting Dr. Naresh Mandava, who accepted a new role of Senior Associate Dean for Strategic Advancement. Thanks, Naresh, for being here today. And thank you to everyone online for tuning in. It's important to me that you, our faculty, staff, learners, and hospital partners, are part of the conversation shaping the future of our School of Medicine. I'm excited for you to hear firsthand from Naresh today on his outlook for advancing philanthropy, which will help sustain and promote all of our missions. We'll be discussing why we created his new role and how it fits into securing our position as a top 10 institution. It might be difficult to think about such ambitious goals during a time of such significant volatility, particularly in federal research support. However, our total funding portfolio remains strong, and we are taking steps to ensure this with our new clinical funds flow model. As I reported in the Monday's Dean's message, we also have heard some good news recently. Nearly all of our NIH grants that were terminated early this year have been reinstated in response to a federal court order. We continue to monitor this activity, and we know this is a challenging time, but I also see it as one of great opportunity to strengthen our hospital partnerships and align our departments. Before we jump into questions from the audience, Naresh and I will cover our strategic priorities in the context of his advancement role. I must say that Naresh was chosen not only for his years of experience, but also for the deep relationships he's established within our community and within the Denver community and Colorado community at large. Naresh, would you care to share a little bit about your vision for this new position, and welcome?
Thanks, John. Thanks for having me today as well. And thank you for the opportunity to serve the school and the campus in this way.
My pleasure.
I'm particularly honored that you asked me because I've been really impressed by the team that you put together.
Thank you.
You have Drs. Chopra, Zimmer, Berg, Ginde. You've really set this lofty goal for this leadership team, as well as our faculty and staff, that we plan to be top 10 in 10. So with this charge, we'll need to scale our present success in philanthropy campus-wide. We know that our school has been quite successful in philanthropy in the past 5 years, particularly because of the strong partnership we have with our hospital partners.
Right.
You look at Children's Hospital, has an excellent relationship with our pediatric faculty and really second to none in philanthropic development. And then you have our CU Foundation at Anschutz that's been very successful in philanthropic efforts over the past decade, led by Scott Arthur.
Right.
Who you and I love working with. Scott. He's an exceptional leader, a partner to you. You
I
work
agree.
with him every day, and our chancellor. And our adult practice, we have an amazing partnership with Sarah Cabot, who's VP of Patient Coordinated Services and Advancement at UC Health. We're really fortunate that we're completely aligned with UC Health. Tom, Liz, the entire team, we're in alignment in terms of philanthropy, and we don't compete. In fact, Sarah Cabot has just been named Assistant Dean of Strategic Advancement by you, and that's in the School of Medicine. And I've been fortunate to work with both Scott and Sarah and their teams for over a decade, and together we'll strategize with the faculty, you and your leadership team as well, and how we position big ideas for investment. We also need to have the patient experience necessary to be on par with the top medical destinations and academic centers. And we're getting there, and I think we have the tools to get there. We can partner with philanthropists then who want to see impactful advancements in medicine. You come from Duke. You know what destination medicine looks like. I think many of our faculty, we have some of the finest surgeons and clinicians in the country. They know what it looks like. So we'll work with them. We'll work with our chairs, our faculty and staff to create a patient experience that's really second to none.
Naresh, I do think CU is second to none. I've been so impressed by the excellence here, both in research and clinic, but also the compassion. And this is a wonderful community. So I'm very excited for us to integrate with the advancement teams at UC Health and Children's Hospital to strengthen our campus as a whole. It is a lofty goal, and it's a tough time, but I know with this leadership team, we can get there. Can you elaborate on how your new role fits into this concept that I've been developing of top 10 and 10?
You know, to be top 10 and 10, I think there's many strategic decisions to make around maximizing the impact of our resources we currently have as well as future resources. We live in times where maximizing our efficiencies, our revenue, but also maximizing the way that we deal with funds flow, and that's something you've done really well here. We've taken that on, and similarly for philanthropy, I'm talking about the opportunity to allocate portions of these large gifts strategically, right?
I think that's a great new concept that I think you can tell us a little bit more about,
Yeah.
maybe?
Yeah, I think as we raise new funds in the school, it's important to leverage the strengths of our school and the campus as a whole, right? And that includes other schools on
Right.
campus. And this includes the basic science programs and major investments we have made in areas such as cell and gene therapies and big data, right? And those proposals that leverage our strengths as a campus will resonate with donors and lead to even larger gifts,
Right.
And you will hear me say time and time again that there is not a shortage of grateful donors out there, right? It's a shortage of big ideas that change the way we practice medicine and how we affect patient outcomes. It's also important to use donated funds efficiently and wisely, right? If we get those funds, the execution needed to achieve the goals that we set for ourselves needs to be exceptional, right?
That stewardship is so important.
Yeah, I mean, I think this is the only way we're going to continue to raise funds from existing and future donors.
Right.
And our partners at Children's, Denver Health, and National Jewish lead their own philanthropy efforts with our faculty. And our goal is to link existing initiatives. We support them, and in turn, this provides additional philanthropic opportunities for the School of Medicine. We're really all of us are in this together, right? And I think it's a great opportunity for all of us.
Thank you for that. I think this idea of building relationships with our community, which can mean our community here, investing in the basic scientists with some of this philanthropy, and investing in our educational mission with some of this philanthropy, and even expanding this support to other schools. This campus is rich because of the other schools and the hospital partnerships that exist here. I'm already enjoying working with you in this expanded role, and I'm excited for the ideas that you've brought to the table. In our last town hall, Dr. Chopra and Dr. Zimmer talked about how faculty and staff could support these initiatives and as newly appointed leaders. So based on questions we've received from our audience, they'd like to know a little bit of the same for your position. How can faculty, staff, how can frontline people that interact with our patients every day play a role in strategic advancement?
Yeah, John, our faculty and staff are really at the front lines of everything we do, right? And patient care is at the center of everything we do. And that is where philanthropy comes from for the most part. You are the first point of contact for our patients and families, and the way that you communicate and partner with them to improve their health is more important to them than really anything in their lives.
Right.
We know that, right? And as you speak with them about meeting their clinical needs, some of which are clinical unmet needs in medicine today, you have an opportunity to not only share your clinical plan, but also research and innovation happening here and sometimes elsewhere. But you can differentiate the research happening here from elsewhere and how we have opportunities on the Anschutz campus to make impactful discoveries. As you connect with the community, our community, you're an ambassador for the School of Medicine, right? And the campus and our hospital partners, which is critical for us to be successful in spreading the word of the great things that are happening here.
Right.
We won't be successful in advancement without partnering with the faculty and staff, who are largely responsible for successes in philanthropy in the School of Medicine to date. and will be the key to the improvements that we hope to achieve together.
Right. I mean, our faculty and staff each have a role they play as part of the CU campus. But what I'd like them to take away from this is that they also play a role as an ambassador. Many times they are the face of CU medicine, they're the face of our hospitals to our community, and that's an extremely important role. For the CU School of Medicine to remain in a position of strength, we really need that full engagement of our faculty and our staff, the people that meet our patients on a day-to-day basis. With the work that you're doing every day, you're spreading that message that this is the place to receive exceptional, compassionate care. In addition to campus-wide engagement, Naresh, you said part of the role is increasing patient access to our care. What's your approach to enable more patients to see the excellent and compassionate care that we provide?
Yeah, I mean, I think to get to where we want to go, we need to have an exceptional patient experience and outcomes if we want to be a top destination medical center. We have the tools to get there. And to start with, we need to have the highest quality and safety. And you and Dr. Chopra have done amazingly well in positioning us with our hospital partner. Tom Grono has been a great advocate of the highest quality and safety and the best outcomes for our patients. And all the things that Dr. Chopra is doing with our chairs, our division leaders, is critical for that. I think we need to also think about improving efficiencies and leveraging platforms like a bridge to improve the patient experience, right? I mean, when our providers have the best wellness, they're able to provide the best care for our patients.
I mean, the data that I've seen on these types of tools, AI can sometimes be frightening, but these types of tools are actually making a huge difference in the time that our providers, our clinicians spend in doing the work that they enjoy less, and it allows them to do more of that connecting with patients. So I think that's a terrific asset.
Absolutely. And Sarah Cabot and I want to increase the access we have to programs such as Pavilion Health and the services that we have to increase the number of, and try to increase the number of doctors in that service. And I believe the most important piece in the recipe for our success is communication and responsiveness, right? Our hospital partners and our leaders have pushed the responsiveness concept that as providers, we need to close the loop on issues and demonstrate that we care deeply for our patients, right? These cultural behaviors are what lead to philanthropy.
Yeah.
I think we all know what leaning in means. I think well over 95% of our philanthropy is a testament to the exceptional care people receive at our institution. And it requires more than a transactional relationship, right? It's more than that transactional relationship with your patient. It requires a strong connection and a high level of trust. And I think that's the key to our success.
Thanks for sharing that, Naresh. I personally have been a patient of yours, and I know how deeply you carry that with you, how that interaction is so important. Now, in talking about the why for your role, you also mentioned the importance of stewarding our resources. And since funding from the NIH now and other federal agencies is less certain, we'll need to be more strategic and more collaborative. Everyone will have a role, and our departments, I think, need to work very closely together. So, Naresh, what role does philanthropy play in response to sort of shoring up support for our research and educational missions in turbulent times?
Yeah. You know, I wish it could, but philanthropy doesn't. We can't expect philanthropy to fill holes or gaps in funding,
Yeah,
right?
that's a good point.
We need to do that with efficiencies and being smart about how we use the dollars we have, and you've set the framework for that very well. I think philanthropic gifts come from grateful patients. People aren't inspired to give to plug gaps. They give to big transformational ideas, to research and treatments for diseases affecting their family members or themselves. And people also want to be part of that success, right? Which is how I see philanthropy advancing our mission in clinical care. Many of our donors are entrepreneurs, and they give with high expectations, right? And you and I have seen some of the things that they ask for, and proposals need to be designed on the front end with the expectation that we can meet requirements of the investment by executing efficiently. And we must report back on our progress each year at a minimum.
Yeah.
There are tools we can leverage to attract transformational gifts, right? There's mechanisms, there's donor matches, there's collaborative proposals, there's cross-cutting ideas. But we need to tell the story of what makes our research, our care, and our people different here on the Anschutz campus.
I think that's an easy message for us. Our research here is extraordinary, our people are extraordinary, and I certainly have experienced that in the short time that I've been here. I've been so impressed by the passion of our people for whatever their mission is, whether it's in the community, the research realm, or education, both in our School of Medicine and other schools on campus.
Absolutely.
That brings up a question that we received from the audience, from Dr. Andrew Suratnak from Pediatrics. And his question is, the recent historic gift to the Department of Ophthalmology, congratulations, Naresh,
Thank you,
is a testament to you, I think, but also the amazing programs and the faculty that you lead. How do we tell that story, right? How do we tell how to enhance that visibility? How do you communicate that philanthropy and the need for that and the use for that across our campus?
Yeah. Thanks, Andrew, for your kind words. I agree. The gift to ophthalmology is a great example. These benefactors were inspired by the exceptional care they received on our campus, not just in the eye center, but throughout our campus. In addition, they were pleased with how ophthalmology had executed on previous investments they had made in our programs.
That's the stewardship you're talking about.
Absolutely.
Yeah.
Absolutely. And they made this gift to ensure that every patient seen at the eye center can experience healing and hope as they did, right? And I think we need to do that more. We do need to do more of that. Every patient story, every scientific breakthrough on our educational side, every student milestone is part of the School of Medicine story. It can't be about one department. We'll enhance the visibility and grow philanthropy by becoming a destination medical center. CU Anschutz is already considered a destination medical center in many areas, as we all know, and we need to scale that excellence across the enterprise, be a destination for complex, life-changing care no matter the discipline. In collaborating across departments, we build a system where potential philanthropists receive an extraordinary care experience by ensuring that everyone receives a top-tier experience. Right. No patient, though, should fall between the cracks, right? And that takes all of us to make sure that doesn't happen. We need to close the loop on lingering issues. We should deserve the patients that come to us for care and build that reputation and consistently deliver on it.
Right.
Not only do you drive better care, but you attract philanthropy, recruit top talent, and become more competitive with respect to NIH funding. It's a self-fulfilling prophecy, right, if you do that. And again, donors want to be part of that success. As clinicians, we know not every patient outcome is good. We hope it will be, but that's not necessarily the reality. It's how we are in it together with our patient, how we care for them, how we communicate and engage with them, sympathize with them, empathize, and how we're in it and we close the loop on lingering questions or issues like I've talked about.
Yep.
And their whole experience should be quality care by great providers. And it takes the staff being involved too to make sure that we don't forget, right? We're all busy.
They're front line.
Our staff needs to say, hey, you forgot to do this, Naresh. Like, go do it. Like, call them. If that's the case, every discipline benefits because when patients have an extraordinary experience, they return, they refer, and sometimes they give.
Yep.
Certain areas are more amenable to philanthropy, right? Areas where patient relationships are built are where most dollars are raised. Cases with complex solutions or high levels of clinical unmet need. So we need to go where those numbers are, right, to attract philanthropy. It doesn't mean the dollars stay there. We leverage those dollars to help the whole. For example, we know statistically many of us in our families will be touched by neurodegenerative diseases or degenerative diseases overall. And so diseases like Alzheimer's or Parkinson's, heart disease, cancer, these are areas where we can excel in philanthropy. All of these areas cross disciplines, so all of us benefit. And it's important in the context of reaching top 10 in 10. We need to link departments and double down where we know we can succeed.
Right. We meet patients at their most vulnerable, right? No one comes here because they're feeling well, right? I mean, maybe that'll be something in our future, but right now they come here because they need us. And I love that concept of healing and hope, right? That needs to be what we provide to our patient experience. And you also talked about the halo effect. If a patient has a great experience in one context, then they'll seek care in other disciplines based on those positive experience. And donors see our mission as interdisciplinary, which creates sort of a wraparound result that elevates the entire campus, not only the School of Medicine, but other schools and their missions on our campus as well. You know, in our last town hall, Dr. Chopra talked about capitalizing on what we already do well, and I think that's an important concept. So this is a great opportunity, I think, for us to talk about the 5 areas of strategic focus that we've identified for the gift from UC Health. Those are broadly heart, cancer, neuroscience, transplant, and musculoskeletal. To be clear though, and this is really important, the playbook here is to leverage these themes across all departments and all faculty. And I do see a role for each department and each one of us in each of these strategic priorities. Naresh, you mentioned degenerative disease, and in neuroscience, we are focusing on this concept of neuromodulation, which can treat a myriad of diseases like chronic pain, Parkinson's, epilepsy, even depression and anxiety. And in prioritizing these areas, we can find niches, I believe, that are truly extraordinary and that will push us to top 10. All that said, I feel we must treat this in a cross-disciplinary, collaborative fashion and use that as a strategic imperative, not just a nice to have. Your thoughts on that?
Yeah, I think it's important to acknowledge this is a huge part of strategic advancement. Leveraging our strengths as a major academic institution to be top 10. It's not just about philanthropy. We want all missions to move forward. Donors want to see that, right?
Yeah.
So collaboration is the engine. Strategic advancement can identify where gifts can infuse capital in ways that move both science and care forward. You know, for example, in ophthalmology, we'll be using portions of the ophthalmology gift to support other programs that support vision science and that meet the donor intent, right? And vision restoration. As you know, as a neurosurgeon, neuromodulation is a major area of promise for restoring sight. We will participate in that broader initiative. And another example is eye cancer, right? It's a sight and life-threatening disease. Just to name a few places my department has, as you say, the halo effect, the halo. And you gave a great outline, I think, this week to the chairs that showed us, I think demonstrated well that we are all connected in some way to these key initiatives. Every department is in the School of Medicine.
Yeah, I mean, for us to reach top 10, we're going to have to take, a dozen bets, and we're going to try to be the very best in those areas. What I was trying to illustrate to the chairs today, and it's a work in progress, it was a starting document, was how each department and each faculty member can be part of that. And you gave 2 examples. While ophthalmology isn't listed in the 5 that I mentioned, it clearly has a role in eye cancer or maybe the restoration of vision. So it certainly sounds like we're aligned there. Earlier you mentioned the concept of allocating portions of each large gift strategically. We received a question from Dr. Jay Hasselberth, who's an associate professor in biochemistry and molecular genetics, and I think that question's appropriate. He asked, most top 10 academic medical centers have instituted a philanthropy tax, including Johns Hopkins, which apparently has one of the highest rates. Do we support a philanthropic tax on these gifts? And I'll start by saying, Jay, that to me at least, and maybe to others, tax generally has a negative connotation. But I like the concept of strategically allocating portions of each gift across missions, across departments, and across schools. I think that's an important new concept that you've developed, Naresh. And this philosophy is grounded in maximizing the impact of every gift, but still maintaining donor intent. Is there anything you'd like to add to that? This is a concept that I think is emerging in our thinking.
Totally in agreement with you on this one, John. I think at the front end, we need to design these gift proposals in a way that we need to make sure that they leverage the differentiating features of our campus, right? When we're an island, we're not exceptional.
Right.
There's other places to give, but when we work together, whether it's clinical, translational research, basic research, they're all essential to finding solutions for complex diseases. And we have the expertise to tackle almost any complex healthcare issue right here on this campus. Every school, every department, every researcher, every patient experience, all of those things contribute to our momentum in funding our total research portfolio.
Right.
And we do recognize the importance of sustaining an infrastructure that enables high-impact philanthropy. So all the work you and our team are doing to create a data-driven approach to our operations will reduce the unnecessary costs and overhead that we have and improve our efficiencies. There's a lot of money there that we can use to leverage donor contributions and direct them toward the people and the programs that matter most to achieving our goals, right? And in short, donors give to make a difference. And we're committed to ensuring that their gifts go as far as possible towards that purpose.
Right. Naresh, we have another question from Dr. Amy Bernard, who's an assistant professor in the Department of Immunology and Microbiology, and as you probably know, has been a champion in science communication. So she asked, how is the medical school or campus as a whole considering the integration of science communication training into future funding opportunities? She added, such a program would not only strengthen our research efforts, but also empower us to share our findings with the broader community. What are your thoughts on supporting this type of a plan? I mean, communication is obviously important. We're here today to communicate. How can it help in your role?
Yeah, I haven't met Dr. Bernard, but thank you for your question, and thanks for how you support us. We really sincerely appreciate your work and advocacy in this area, and I think we can agree that advocating for science is no longer optional. It's critical for public trust, donor support, and to a certain extent federal funding. And we need to continue our focus on advocacy and informing policymakers, providing them with the necessary information about the value our faculty bring to groundbreaking research in clinical care. Our hospital leaders are on board with this. We're exploring how to support communication training for faculty, residents, fellows, students, and so they can explain their work in clear, compelling ways. And this helps us reach taxpayers, policymakers, and donors. And absolutely, this is a major opportunity. We should build science communication into the training pipeline, including professional development. You could do media coaching, interdisciplinary partnerships. We want to empower our researchers to speak confidently, right? And not just to journals and grant reviewers, but to the public, patients, and government officials. I think the CCTSI has organized advocacy efforts in the past, including the workshop series. I think it was called Communicating Your Science to the Public, which I know Dr. Bernard was involved with. Just coincidentally, this morning, the Denver Museum of Nature and Science, I'm on the board of the museum for the past decade, released a notice of a policy and science program, and Dr. Bernard is participating in that.
That's wonderful. Yeah.
And that's a testament to the great faculty we have. Scientists like Dr. Bernard, who can speak to the people in our community in a way that they understand, I think is key. All these efforts strengthen our case for support and deepen our impact.
Yeah, I mean, that helps keep our community informed. And of course, part of our community are grateful patients and donors. So that's always helpful.
Absolutely.
We know that we all have to be champions of science communication on our campus, and we're already doing some great work there, but there's more to be done. I think we have time for maybe one final question from our audience, and we have one that came from Dr. Natalie Surkova in radiology. She said, modern technologies come with a high price tag, and we know that. What are our plans to raise funds for cutting-edge technology at centers like Anschutz? And how do we get donors excited about technologies? Have you done any thinking on that?
Yeah, I mean, we have so many expensive technologies we've already invested in on this campus. I think Dr. Surkova is absolutely right. Cutting-edge technologies like those involved in, we've spent a lot of money on technologies in cell therapies.
Yep.
We'll continue to spend money on advanced imaging, AI, and big data. Those are areas we'll make big investments as an institution. And You're orchestrating that with our chancellor and our hospital partner. And neuromodulation, which you mentioned earlier, are expensive. They're expensive to implement.
Right.
But if we want our campus to be a destination medical center, it's essential that we make these investments. And I think the way you do it is you lean in on telling the story, right?
Right.
Donors won't be inspired by new equipment acquired. They'll be moved by what the technology is going to do for patients,
Yeah.
for people. And that's faster diagnoses, life-saving precision therapies, new ways to treat diseases affecting their lives and the people they love. And really showing a donor how a new technology directly benefits patients allows the donor to see themselves as a part of the solution.
Right.
They want to partner. They want to be a part of that solution.
Yeah, that's a great point. I'll add that investing in new technology will require this cross-disciplinary collaboration again, right? With its expense, we need to sort of spread that investment over different departments and different faculty. I firmly believe we are better together, and if our departments focus on technology that integrates clinical care, basic science, and innovation, it does allow for those breakthroughs to happen. A technologically integrated campus, as we've talked about, is a magnet for talent, for patient-seeking care, and additional investment from donors and even our hospital partners. The priority areas we've discussed play into this by identifying what I would call flagship opportunities for donors to be involved, like the things you've mentioned, cell therapies for cancer. I'd add to that robotic surgery for transplants, and leveraging AI in a big way, which we plan to do on this campus. The list goes on, but those are some of our priorities at this time. Naresh, it seems like you and I are aligned on the strategy for structuring these gift opportunities around patient impact and research leadership. I do think when donors see the potential impact on patients, not just infrastructure, but on lives impacted, they'll certainly want to be part of our success here at CU.
And I think our faculty get that too, John. I think
Great.
they're,
Well,
they do get it.
that's part of your new role here, is to make sure that our faculty are involved and our staff, as we've mentioned.
Absolutely.
So thanks for being here today. It's been a pleasure. And I truly appreciate all of you online for joining us today and sharing your time with us and submitting your thoughtful questions. For those of you who might not know, House Representative Jason Crow will be on our campus Thursday, August 21st, talking about federal policy changes that are impacting our mission on the Anschutz campus. I'd encourage you all to register for that forum and submit questions. I certainly look forward to featuring other campus leaders as I continue my town hall series. We've received feedback recently that you're interested in hearing more from our hospital partners. So at our next town hall, I'll be joined by Tom Gronow from the UC Health Authority. We're excited to answer more of your questions and share more about how the crucial issues on campus and our partners with the hospital systems around us are critical to our mission in the school. I encourage you to scan the QR code on the screen and fill out a quick feedback survey. We're trying to do this for you, so please tell us how we can get better. A recording of this session is already available on the Dean's Office website for anyone who might have missed part of it or wishes to revisit this discussion. I'll also share the recording link in my next Dean's message. Thank you all again for joining and for your compassion and your care. Have a great day.